Today we'll be looking at Tetralogy of Fallot, a condition with 4 defects remembered as proof. Pulmonary infundibular stenosis is where there is a narrowing in the right ventricular outflow tract as seen here. Right ventricular hypertrophy occurs because the muscle thickens when there's an increased load on the right side when it's trying to pump. Overriding aorta and ventricular septal defect. When the blood can't get through the narrowed pulmonary trunk, it's shunted from right to left, entering the systemic circulation via the overriding aorta.
Tetra means 4, so we can remember these 4 defects which occur together to produce a shunting of deoxygenated blue blood from right to left as it struggles to get through the narrowed pulmonary outflow. As such, Tetralogy of Fallot is a cyanotic heart disease, as the systemic circulation now consists of mixed blood with a lower oxygen saturation. So we now know that Tetralogy of Fallot is a cyanotic heart disease.
These days diagnosis is often at antenatal ultrasound scan. However, a murmur will also be heard within the first 2 months of life. Some neonates have very severe cyanosis at birth, but the majority of cases, if not picked up now, will be picked up during childhood. It's the most common cyanotic defect in kids, and the trademark presentation of Tetralogy of Fallot is what we call TET spells of hypercyanosis. So now we'll try to understand what's happening during these TET spells. So what are they? It's when a child stops and squats, usually during exercise and usually in toddlers. Now the reason behind this is because we have a narrowed right ventricular outflow, which means that pulmonary blood flow is effectively reduced, and the ventricular septal defect creates a large right to left shunt. Now during exercise, the demand for oxygen increases, yet the pulmonary flow is not enough to meet these requirements. So squatting is a natural way for the child to increase venous return, which leads to an increase in systemic resistance affecting the left side of the heart. And because there's greater resistance on this side, the right to left shunt is reduced. So more blood is pumped through the narrowed pulmonary valve, increasing pulmonary blood flow and therefore increasing oxygenation. What are the characteristics of TET spells? Well, there's rapid cyanosis, the child is likely to be irritable and crying, and also pale due to tissue acidosis. These spells are serious and can result in myocardial infarction, cerebrovascular accident, and even death. However, childhood TET spells are rare in developed countries, as most cases are picked up by antenatal screening. When they do occur, spells usually self-resolve and the child will sleep. If they last longer than 15 minutes, we need to administer morphine, IV propranolol, which causes peripheral vasoconstriction to increase your venous return, IV fluids, bicarbonate to correct for acidosis, and muscle paralysis and artificial ventilation can help to reduce the metabolic oxygen demand. On to examinations and investigations. When you listen to the heart, an ejection systolic murmur will be heard at the lower left sternal edge. This is present from day 1 and tends to shorten over the years as obstruction to outflow increases. ECG is usually normal at birth. Over time, right ventricular hypertrophy becomes apparent. In the chest X-ray, you will also see this boot-shaped heart to indicate right ventricular hypertrophy over time. And echocardiogram and cardiac catheterization will be the definitive diagnostic tools, as with most congenital heart disease. Now initially, in the diagnosed neonate, treatment will be medical. And for severe cases with neonatal cyanosis, a Blalock Tausig shunt can be used to enable blood from the subclavian artery to reach the pulmonary artery. 6 months of age, surgery can be undertaken. This is to close the ventricular septal defect and also relieve the outflow obstruction from the right ventricle. Methods include balloon dilatation of the valve, or placement of an artificial pulmonary valve patch.